Hello, everyone. My name is Dr. Sobia Amreen, and I'm a proud Mars scholar. I would like to thank Mars and Dr. Noran for giving me the opportunity to learn a very important course on research to publication, jointly developed by the BMJ and UCSF. Today, I will talk about one of the many important topics that I learned from this course, and that is good medical writing. Good medical writing is extremely important in presenting the findings of a research and sharing knowledge and evidence with a wider scientific community. It is essential to write about experiments and studies that scientists do in a way that is clear, accurate, understandable to a wider audience. Generally, a format that is followed to write good research papers is the IMRD format. This includes an introduction, method, results, and discussion. The scientific method included in each of these components are as follows. In introduction, we ask a research question and then do relevant background search the relevant literature and understand the context of the study globally as well as locally, and identify a research gap. Based on this, a hypothesis is developed. In methods section, we tell the details relevant in testing the hypothesis. In results section, we analyze the data and present the results obtained from the data that we collect. In discussion, we interpret the results that we obtained and discuss its relevance with the literature, its consistency or deviation from literature, and we also discuss the strengths and limitations of the study, which are important to discuss to develop recommendations for future research. I will discuss some basic rules about writing that are important to note when writing for its style and language. So we should think well before writing, be clear and concise. We should cut clutter and avoid jargons. We should be short, clear, and concise. Be specific, avoid too much crowding, keep the sentences short, and use the active voice, more direct and more concise. So we should follow a proper methodology. Structure and flow should be accurate. Follow journal instructions, which is very important. Should contain a proper introduction, method, purpose, and conclusion, and the writing should be easy and understandable. So, when we're writing a scientific manuscript, it's important that we write on have based on evidence. For example, if we're writing frequency information, we should use terms like incidence and prevalence, not common or rare. Similarly, for diagnostic tests, we can use false positives, false negative rates, sensitivity, and specificity. For prognosis, we can use terms like remission, progression, and risks. And for treatments, we can use levels of evidence, relative and absolute risk reduction, number needed to treat. Levels of evidence are very informative. We can say there's no clear evidence, or there's suggestive evidence, or there's firm evidence. What do you mean when you say no clear evidence? It's opinions based on clinical experience, case studies, conflicting evidence from studies, or poorly designed studies, even if our cities. And what suggestive evidence means, it comes from cohort, case control, before and after studies, and non randomized experimental studies. And firm evidence comes from at least one properly designed randomized control trial with adequate sample selection, sample size, and appropriate controls, double or single blinded, and clear outcome. It's important to follow the ICMJE recommendations when writing a manuscript. The International Committee of Medical Journal Editors is a small working group of general medical journal editors that develops the recommendations for the conduct, reporting, editing, and publications of scholarly work in medical journals. These recommendations are updated annually and they provide a minimum standard for reporting research. This is the ICMJE recommendations guidelines website. There are other sources for writing which can guide us. For example, there's the Equator website, which provides reporting guidelines for different types of study designs and the standard reporting guidelines that best fits the specific study designs. For example, consort, strobe, etc. And there's author aid, which is particularly important for supporting researchers from the LMICs. And there's European Association of Science Editors, EASE, which provides guidelines for authors and translators of scientific articles that are going to be published in English. Sometimes papers are not written in English and mostly languages other than English are used. So in that case, a translation into English is important for understanding of a wider population, wider audience. So for that purpose, automated translation is used sometimes. However, studies have showed that automated translation is less accurate and it's not reliable. So what should we do in that case? We can use professional language translator services, and this is acceptable by journals to use professional medical writers or translators. However, it's important to declare such assistance according to the Good Publication Practice guidelines. Some journals also provide translation services, for example, BMJ. So, in summary, we should use the IMRD format for writing scientific papers. We should write clearly and be specific. We should follow standard guidelines. When required, we should use professional translation services and always always write keeping ethical concerns in mind. That is very important component of writing. So that's about it, and thank you so much for listening.